Hi, my name's Jackie and I did my Psych 498A presentation on autistic disorder, the clinical presentation. So, autism is an amalgamation of two Greek words. The first one is aut, which means self, and the second is ism, which implies orientation or state. Therefore, autism could be defined as a condition where someone is unusually absorbed in him or herself. Autism is a pervasive developmental disorder, so it's characterized by severe and pervasive impairment in several areas of development. For example, social interaction skills, communication skills, and the presence of stereotyped behavior, interests, and activities. Parents usually can tell that their children have autism in the first years of life, sometimes in the first year of their life. Sometimes parents notice certain developmental delays, sometimes a little bit after the first year, but definitely in the first 3. Autistic disorder is abnormal or impaired development in social interaction and communication, and a markedly restricted repertoire of activity and interest. So autism is sort of considered on a spectrum, and people are diagnosed ranging from mild to severe autism. Some people also believe that Asperger's syndrome is a high-functioning variant of autism. However, there are some distinguishable features as well. So this is the DSM-4 revised edition criteria for diagnosis. So basically, to be diagnosed with autism, you need to have a total of 6 or more items from 1, 2, and 3, with at least 2 from 1 and 1 each from 2 and 3. So basically, just the main categories are: 1 is a qualitative impairment in social interaction manifested by at least 2 of the following, and it kind of talks about nonverbal behaviors such as eye contact, facial expressions, relationships, those kinds of things. 2 is qualitative impairments in communication as manifested by at least 1 of the following. So delay in language development, stereotype behavior, lack of various spontaneous make-believe play or social imaginative play. And then 3 is restricted, repetitive, and stereotype patterns of behavior, interests, and activities as manifested by at least 1 of the following. So some examples are persistent preoccupation with parts of objects, or encompassing preoccupation with 1 or more stereotyped and restricted patterns of interests that is abnormal either in its intensity or focus. So lab findings and medical conditions for autism. There have been some group differences in some measures of serotonergic activity, but they're not diagnostic for autistic disorder. In some cases, imaging studies may be abnormal, but there's no specific pattern that's been clearly identified. EEG abnormalities are common regardless of whether seizures are present in the autistic disorder or not. It is common that children diagnosed with autism will also have seizures as part of their diagnosis. There are also a few other various neurological symptoms or signs that may be present with autism. Some of those include primitive reflexes, abnormal gait, delayed development of hand dominance, and that's about it. So moving on to inside the brain. Neuropathological studies in autistic brains have shown small neuronal size and increased cell packing density in a variety of the limbic structures, including the hippocampus, which is right here. So a few other findings that have been found in research recently is that the GABAergic receptor system is significantly reduced in high binding regions, marking an abnormality in the GABA system in autism. but they didn't find anything in the other receptor systems in this specific study by Blatt, Fitzgerald, Guptill, Booker, Kemper, Bauman from 2001 called Density and Distribution of Hippocampal Neurotransmitter Receptors in Autism, an Audio-Radiographical Study. So this information comes from the Autism Society of Canada, and basically on their website they list 5 sort of general characteristics of autism spectrum disorders. So it says children and adults with ASDs have challenges with social interactions, verbal and nonverbal communication, the ability to learn in the usual settings, and repetitive behaviors, as well as unusual or severely limited activities and interests. So some of the behavioral symptoms of autism are hyperactivity, short attention span, impulsivity, aggressiveness, self-injurious behaviors, and temper tantrums, particularly in young children. So some sensory difficulties are often experienced with autism. Some of the sensory difficulties experienced can be specific touches, smells, or sounds that can be disturbing or uncomfortable for children with autism or people with autism. This is a quote here from Priest, 2007. It says, specifically, students with autism may have difficulty or at least differences tolerating noise, visual movement, tactile input, and multiple distractors. So there are other difficulties experienced by people who have autism. Sometimes people with autistic disorders have difficulty with their sleep. Sometimes they wake up in the middle of the night and rock. There's also abnormalities in mood or affect, lack of fear response, and excessive fearfulness. And moving on to the prevalence of autism. So the exact prevalence of autism is unknown still. The DSM-4 revised edition estimates that the median rate of autism in epidemiological studies is around 5 cases in every 10,000 individuals. However, these rates range from 2 to 20 cases per 10,000 individuals. So that basically works out to 1 person in 500 to 1 in 1,000. There are some differences between males and females. So males are more likely to be diagnosed with an autistic spectrum disorder, but females, when they are diagnosed, they're more likely to have more severe mental retardation as well. Also, siblings. If a child in a family is diagnosed with autism and there are siblings in the family, the risk for an autistic spectrum disorder diagnosis for the sibling increases as well. Approximately 5% of siblings are also diagnosed with autism, and they also are at risk for various other developmental disorders or difficulties. So the course of autism, like I said before, autism is a pervasive developmental disorder, so it follows a continuous course through infancy, school age, and adults. Follow-up studies suggest that a small percentage of individuals with autism are able to live independently as adults. In 1/3 of the cases, some degree of partial independence is possible. So then I just have some references here. Websites that you can check out.
Sure did. Because they never